Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health, and well-being. And in this episode, we are going to talk about World Mental Health Day. Every year, October 10th is observed as a World Mental Health Day all over the world. This day is used to promote mental health awareness about mental illnesses, advocacy, and in some instances also supporting the policy or developing a policy, advocacy regarding a particular policy in relation to mental health are observed during these days. This is not one day, we can observe it over a week, over a couple of weeks, and this, what we start in this day, continues for a longer period also. So this year theme, every year, there is a theme to observe for World Mental Health Day. This year theme is access to services, mental health in emergencies. That is the theme. And all over the world, mental health related organizations and bodies will be having activities supporting and promoting this theme. And you might ask me, who is giving you this theme? Who proposes this theme? There is an organization called World Federation of Mental Health. This is an international organization. That organization comes up with a theme every year. Let me tell you something about the organization. The organization is called World Federation of Mental Health. In abbreviation, we call it as WFMH. It is an international organization. The idea for this organization came from one George Brock Chisholm. He was a Canadian psychiatrist and he was also the first Director General of World Health Organization. You might know World Health Organization was started in 1948 following the establishment of UN. It is one of the UN body, United Nations body. And George was the first Director General for World Health Organization. He is a Canadian psychiatrist. He is also first World War veteran. And he proposed the idea that we should have an organization, an international organization, a non-governmental body to provide links to grassroots level organization all over the world. Now, all over the world, in every country, there will be some organization relating to mental health. It could be a government service offering mental health treatment and related service, or it could be non-governmental, or it could be charity, or it could be even individual promoting mental health services or awareness of mental health. So WFMH kind of acts as a link between these organizations and United Nations. And that's how these organizations come into being. And since then, since 1948, the late 40s and early 50s, it has been there. And this is one of the kind of apex organization which can coordinate mental health advocacy. Coming to World Mental Health Day, this theme was first proposed in 1992, much later after establishing that organization. And this was initiated by the then Deputy Secretary General Richard Hunter. So it was started, the day observation started on the 10th of October 1992. First couple of years they didn't have a theme. It is in 1994 they came up with a theme. And the first theme was improving the quality of mental health services throughout the world. That was the first theme in 1994. So let's talk about the theme itself. WFMH comes up with a document explaining about the theme, importance of the theme, and what is the current scenario, what can be done about this particular theme. And many other organizations all over the world follow this document. And you can develop on that. It's not necessarily need to be confined to this particular theme or particular document. You can do it according to your local needs also. Let's talk about the theme itself. The theme is mental health in catastrophes and emergencies. Basically, it's talking about access now, because we know access to mental health services varied, and we also know in developing country the access is not that great. I would say even in developing countries or developed countries, access might be difficult. Depends on the resources. Okay, so let us talk about mental health in emergencies and catastrophes. Almost everybody who is involved in an emergency or natural calamity will go through some psychological distress. It could be a victim, it could be a services which is going there to help them, voluntary organization, government services, individuals involved can go through psychological distress. It depends on what they see, how much they are involved. Research says about 20%, to be exact, 22% of the people who are involved in a war or a conflict in the past 10 years, in the previous 10 years, have developed depression, anxiety, PTSD, and even bipolar and schizophrenia disorders in the next 10 years. So more common is depression, anxiety, and PTSD. Bipolar and schizophrenia, I may not say that caused the schizophrenia, that could have precipitated in a vulnerable individual. So more commonly we see anxiety, depression, and post-traumatic stress disorder. We will discuss about that in next episode about PTSD. And also emergencies, natural calamities disrupt the mental health services, and it can cause disruption to normal delivery of the services. And it can also reduce the availability of services or quality of care. The next point is the people suffering from mental health problems are more vulnerable during emergencies and calamities. And they need access to mental health services and mental health care. In addition to a person who didn't have any mental health problem prior to the calamity or prior to emergency, they also need, and person who already has mental problem also need mental health care. So this situation, emergency or calamity, can be categorized into three. One is pre-existing situation, an emergency induced situation, and the humanitarian response which can induce certain problem. So let us look at each one. So the pre-existing, let's take mental health problem. If a person who is going through the emergency might have had depression or even alcohol dependence or schizophrenia or bipolar, some established mental health problem. The second one is emergency induced situation, where emergency itself induces certain psychological problem. It could be grieving the lost person. Now, the person going through emergency might have lost a close relative and going through that grief and acute stress reaction to the whole situation, what is happening. And that can lead to harmful use of substances. They can take on to alcohol, or they can go into a PTSD, what we call it as a post-traumatic stress disorder. These things can be induced by emergency itself. Suppose there is an earthquake. Earthquake can induce any of these: grief because loss of lives, acute stress reaction, reacting to the whole situation, what is happening. It is beyond the normal human experience. It is that something is unheard of. That can lead to extreme stress and acute reaction to. And it can lead to post-traumatic stress disorder immediately or later on. Now, people can develop PTSD symptoms not immediately, even 6 months later. So these are all the emergency induced, that particular incident, earthquake or war or natural calamity can induce all these things. And thirdly, we all know when there is a calamity, then something goes wrong, some emergency, some catastrophic incident or happen, that can elicit response from people. Everybody wants to help. Now everybody wants to do something about it. They can donate to charities which is helping the situation, or they might even like to go there and personally help them. This response itself can induce problem. a person is in an emergency situation, a natural calamity, there are many things they'll expect. Now, they might have anxiety about what's going to happen next. Who has survived? What I'm going to do? What I'm going to do? How I'm going to get my next meal? Or where I'm going to stay? Where I'm going to sleep next? All those things, immediate problem itself can induce a lot of anxiety and problems. Okay, next is mental health services. Now, pre-existing mental health services in a developing country, not well developed, they may not have very robust mental health services and limited access to quality of the services and affordability of mental health care. And in an emergency situation, but the emergency incident can itself damage the services. For example, there is an earthquake. Earthquake happens in an area where there is a mental health center, and that center is damaged and they cannot function. And emergency itself, the incident itself can lead to disruption in the medical services or supply of medicine. Supply chain can get disrupted because road can be destroyed. So all these things can be related to emergency situation itself. And humanitarian response. Now, lack of coordination. Now, everybody lands up in a place where there's an earthquake. And everybody wants to help. If the service is not coordinated, there is no streamlining, or there is no sufficient training for the staff who's reaching there, can itself produce problem. So we are looking at different kind of a mental problem relating to an incident or a calamity or catastrophe which is happening. So it can be pre-existing, emergency itself can produce that, or humanitarian response can also increase the problem. So that needs to be organized. So looking at the social problem, social indicators or social factors, pre-existing social factors, poverty, discrimination, and it could be racial, it could be color, it could be economic status. There are many ways discrimination can creep in. If already it's existing, that can be exaggerated in a stressful situation or in a calamitous situation. Emergency induced family separation, lack of safety, loss of livelihood, earthquake, individual might say, I lost everything, my house is completely demolished. What I'm going to do for my next livelihood, next day meal, where I'm going to stay? All those things are social factors which comes into the calamities or emergencies which can affect the mental health. And as I said, humanitarian response. In a social situation, it could be overcrowding. There are many people coming with bags and bags of relief material and leaving them there, or they're not able to reach the people who are suffering or who are victims. And if it is not coordinated, that social problem can also compound the mental health problem. Okay, next is, I talked about people who come in to a disaster site need to be trained. That is very important, because all of us are not trained to manage or face a disastrous situations. And some of us might even find it very difficult to cope with a crying person. Suppose somebody breaks down in front of you, starts crying. Now, some of us may not have the skills to manage that situation because they themselves can break down. So that's why you need a trained personnel at the proximity of the disaster. Not everybody need to rush in and then try to do something. They can channelize their help, but the person who are there dealing with the mental health, with the emotional distress, need to be some kind of a train. I'm not talking about a psychologist or psychiatrist visiting the place. They may not have a bigger role there, but whoever goes there, a health professional, they need to be trained to a certain level about how to manage, how to communicate, what to tell them, how to make them feel safe. All those things need to be there. And also, if there is a treatment available, we need to look at how that can be delivered. We can't be sticking to a protocol what we already have. We might have to modify the protocol, modify even our treatment. So those things need to be taken into consideration when you are dealing with a disaster or emergency. And many a time it is overlooked. Human rights of the people who are involved in the catastrophes or calamities. Sometimes, because of the enormity of the situation, we might forget certain basic things. One of the fundamental things is human right. So human right can be compromised because of discrimination. Now, color, case. Now, so the human rights can be compromised because of the discrimination based on color or race or many other factors. We need to be aware that there can be a compromise of human rights. We need to be aware of that. We need to be keeping in mind when we approach and deliver whatever we are going to deliver to that victims. Okay, next is a little bit about the recovering from the disaster. Because the disaster happens, earthquake or a cyclone or whatever happens for it could be few minutes to few hours. Then slowly we get back. We go away from that and then we try to recover. What happens emotionally? I'm not talking about the physical aspect, that's a big topic itself. I'm confining myself to mental health and mental well-being. So recovering emotionally from a disaster. We all know emotional disturbance are very high during a disaster. So the feelings can be very intense and unpredictable. I can be very calm or I can explode with anger or irritability. Depends on the personal makeup, the resilience what we have, and also the situation around them. And thinking might change. We might have extreme negative thoughts. We might think, I'm not going to recover at all. That's gone. I've lost everything what I have. Now, I don't think there's anything I can do to recover. So, extreme negative thoughts. Negative thoughts lead to negative perception. Negative thought and perception lead to negative behavior. So, behavioral changes can be there. I may not access any services. I may not access any help which is there because I'm given up. The disaster has destroyed me. And I can be very sensitive to environmental factors. Now, whatever happening in the environmental factors, whatever natural changes or social changes which is happening, I can be very sensitive. I might react to that. Now, if there is some kind of order, regulation that is needed in that place, I might be very sensitive to that. I might say, why are you preventing? Why can't I go there? So I can become hypersensitive to environmental factors. And interpersonal relationship can be affected. Because of my reduced tolerance and irritability, I can develop problems. I can become arguments. I can start blaming people. That can lead to interpersonal difficulties. Not only in the society, in a personal life also. To our close relatives, I might become irritable. So that is strained interpersonal relationships. And remember, stress can also induce physical health problems. That's a big topic. Okay, so next is warning signs. Now, sometimes people might go away and say, I'm all right. No, I'm not affected by these things. Now, it might come from their psychological makeup, their cultural belief, and they might say, oh, I'm fine, I don't need anything. But they need to be aware of early signs or warning signs of emotional reactions. They might have problem in sleeping. When I say problem, it could be loss of sleep or difficulty in getting sleep, or excess sleep can also be a problem of emotional distress or emotional problem. And irritability, as I said, irritability, anger, feeling of rage can be there now, and which can lead to behavioral change, aggressive behavior, lashing out people. So it might happen kind of episodically. The person may not connect this to the disaster he has gone through. So it could be effect of the disaster or emotional distress which he has gone through. And sadness, they can have some kind of a sad feeling all the time. Sometimes it can be very, very overwhelming. They might break down also. And they may withdraw from people, withdraw from the friends, withdraw from the relatives. They may not attend any functions or any parties. It can happen in days, weeks, months also. This can emerge in months. That could be effect of the disaster which has on that individual. And they might feel they have lost energy. They may feel tired all the time. It could be one of the signs of depression. Listen to my episode on depression, lack of energy. Anhedonia, losing interest in activities, can be a symptom of depression, and always feeling tired. So sometimes they get involved in a lot of activities. That one way of coping, forgetting everything. They tax themselves a lot of activities. They don't give a minute rest to themselves, keep themselves busy. But they should also realize it could be one of the coping mechanism, but they should also look for warning signs of emotional distress leading to all these problems. Next episode, we are going to talk about mind your mental health channel itself. We started this channel in the year 2020. We retired in 2019. A year later, we started the channel on a World Mental Health Day. We started the channel on 10th of October 2020. Initially, we started in Tamil language. It is one of the language spoken in India, southern part of India, a state called Tamil Nadu. And I started the channel in that language. And in the past 4 years, we have done many episodes covering many aspects of the mental health. In 2024, I started the English channel. So we titled as Mind Your Mental Health channel. And we have done so far 24 episodes. And we are going to talk about the channel and what we want to do in future in our next episode. Thank you for being with us. Thank you for your support. Do subscribe to our channel. If you think it is helpful to others, you can share it to your friends and relatives. And we also welcome comments.